We are telling our viewers, and while we fix your audio, we're telling our viewers about what the government of India has said essentially. Just to reiterate this for our viewers, essentially to drive home the point that there should be no vaccine hesitancy against, against vaccines in general, and also against COVID-19 vaccines. Because the government of India has said, and this is through the Indian Council of Medical Research and the National Center for Disease Control, that there is no reason to link these sudden deaths between the ages of 18 to 45, the younger population to, so to speak, on these vaccines. Essentially, these are cases of heart attack, and also telling our viewers a little more about what has been seen over the last few years or so. I'm telling you about Delhi's PSRI Hospital, which has reported, and this is anecdotal and the hospital's own data, 50% of heart attack patients were below the age of 40, something that Dr. Ashok also spoke about, post-COVID. Also, this is another set of data that is coming in from a hospital in Bengaluru, which shows 31% of heart attack and angioplasty procedures were done in men around the age of 40 or under. This is also another study that was done by a hospital in Bengaluru. Essentially, 300% increase is what Dr. Ashok Seth pointed at, that there was an increase in heart ailments in younger people who had severe COVID. Post-COVID thrombosis and COVID thrombosis. Many people, 20% of those who succumbed to COVID, is what Dr. Ashok Seth has reiterated, died of heart attacks. Essentially, they were COVID positive, but they succumbed, and the reason was COVID-19. All right, let's also tell you a little what this means for all of us, the younger population, for India's youth below the age of 40, 45. Early screening, something that doctors have been emphasizing on. Just ask around you how many people are regularly checking their cholesterol, blood sugar, ECG, blood pressure. From the age of 25 to 30, something that should be done. Lifestyle modification, balanced diet, regular physical activity is something that we all need to look at. Reduce our smoking, processed foods, proper sleep, stress management, importantly, I believe, a silent killer. Awareness and education, recognize atypical symptoms, jaw, back aches essentially, and also fatigue. Learn CPR, something that I wish Dr. Seth to in fact throw some light on. Early access to emergency care, should that not be made mandatory in schools? Of course, research and policy, which is multi-center studies, public health initiatives done in this direction.